Hi, I'm Bryan Brandon. I'm one of the facial plastic surgeons here at FAC. I'm double board certified facial plastic surgeon. That means I specialize in cosmetic and reconstructive surgeries of the face and the neck. Facelift, that is a great question and something that gets asked all the time. People come in all the time and say, I don't want a full facelift. I only want a partial facelift, or I want a mini facelift. There's so many different terms that encompass facelift. It's actually very confusing. And, if you ask 10 different, plastic surgeons what their definition of a facelift is, you're probably going to get 10 different answers. And it just goes to show that, we've been doing these for many, many years and the techniques have evolved over time. I like to take an anatomic approach to defining a facelift. And so when I say facelift, I'm really referring to the lower face. So everything from the cheek down through the jawline and the neck. And so I think a more appropriate name for facelift is probably a lower face and neck lift, because that's what we're actually lifting. So when someone comes in and says, I want a mini facelift or a full facelift or any of these different variations, I will generally hand them a mirror and we'll sit and look together at the mirror and look at what has actually fallen, what has gravity pulled down, and what, when they look in the mirror, what bothers them. And that's what really we talk about. And so, if the cheeks have fallen, that's what needs to be lifted. If the jawline has fallen and you have jowls, that's what needs to be lifted. If you have platysmal bands in excess in the neck, that's what needs to be lifted. And so in general, when I'm talking about a facelift, I really mean the lower face and the neck. And there's a saying in the plastic surgery circles that, the best neck lift is a facelift. And so, that just kind of adds to the confusion. But a lot of people that come in saying, I want a neck lift, really what they need is a facelift. That entails incisions in front, behind the ear, down the hairline, and generally a small one underneath the chin. Underneath the chin, we can remove or sculpt fats, tighten a muscle called the platysma muscle, and then up by the side of the face, we can dissect under the skin for just a short period of time before we transition underneath the muscle and release something called retaining ligaments of the face. These are not really ligaments, but tethering points of the face, and that allows us to lift and reposition passively the face and essentially put it wherever we want under no or little tension. And that's super important because facelifts, of years ago used to just literally pull and tighten and stretch the skin, and that's what leads to all the stigmata of facelift that you see walking around that everyone, desperately wants to avoid. Fortunately, with modern, deep plane facelift surgery, we just don't see the windswept look anymore because we're really not tightening and pulling on the skin. We're not stretching the skin. If you pull and stretch the skin, you're going to get a pulled and stretched mouth. And so by releasing these ligaments and then just kind of lifting vertically instead of horizontally pulling, we're able to avoid a lot of the really, scary, weird results that people really are trying to avoid.